Welcome to ACAP Guilford's monthly meeting. We're so glad to have all of you join us today. Are you familiar with ACAP? Let me tell you just a little bit about it. ACAP Community is an educational nonprofit organization that offers information, resources, support, and community for those of us who are caring for aging parents. As you can tell from our name, our focus is on supporting adults as they care for their aging family members. However, all caregivers are welcome, whether you're an adult child, another relative, a friend, or a professional. Each of our 9 ACAP chapters located across the Eastern Seaboard offers monthly programs that address issues related to aging, family dynamics, and adult-child caregiving. Presenters are experts on the topic they address, and many of them actually have been caregivers themselves for their own parents or in-laws. ACAP Guilford meets on the third Thursday of each month. Our meetings begin with a light lunch and a chance to talk with others who are caring for their aging parents. We begin at 11:30, and all you have to do is RSVP so that we make sure we have enough food for everybody. As I say, we'll provide lunch, and then at noon we'll begin our program. The program takes place at Senior Resources of Guilford, 1401 Benjamin Parkway in Greensboro. Folks who simply can't participate in person can view our programs on our YouTube channel when we post them after the meeting. We'd like to thank our sponsor for today, PACE of the Triad. Would you welcome with me Takia Cleveland?
Good morning. So I am Takia. I am the outreach specialist at PACE of the Triad. And just to tell you a little bit about PACE very quickly, we are a program of all-inclusive care for 55 or older. We provide unlimited medical transportation. The medications are covered at 100% and delivered to your home. We also provide incontinence supplies. We have dental, vision, and therapy all in-house in our facility. We also have a primary care doctor on site. And we are caregiver friendly, so we work very close to those that we serve and their caregivers or their contact person to be able to be a part of PACE. Our whole goal is to help people be safe in their home and community that are 55 and older. Thank you.
Thank you so much, Takia. Thank you for sponsoring us today and for being a continual supporter of ACAP Guilford. Today our program is called After the Hospital, How to Provide Care for a Loved One. So often, as our loved one prepares to leave home and leave the hospital and settle into aftercare, we're faced with care, information, and resources and referrals, even medical responsibilities that might be confusing to us. How do we understand how to provide care and what resources are available to us as care providers? Today, we are very fortunate to have Patty Aiken, Janice Burns, and Sue Joseph of Homestead provide us with information that will help us with these responsibilities. Patty Aiken and her husband Lee Aiken are the owners of Homestead, a locally owned and operated franchise of the Homestead Network. Homestead provides in-home, non-medical services for the Guilford County area and has done so for over 24 years. 16 of which the Aikens have been the owners. Patty is a native of Greensboro and graduated from Meredith College in Raleigh with a BS in Business Administration. Her career includes 25 plus years in general management and human resource roles for several locally owned businesses. She maintains her senior certified professional certification in human resources by the Society of Human Resource Management. There's so much more. She is an active volunteer on many boards in the area as well. But I'm going to invite her to talk about herself and introduce the other people who are with her today. Thank you all for being here today.
Thank you, Cheryl, and thank you, everybody, for allowing us an opportunity to be with you. I have with me and behind me and beside me, wherever we can fit, so that you can see us. Janice Burns, well, I got it's backwards here.
Right.
Janice Burns is our home care consultant, and she is responsible for meeting with prospective clients or their family members who are interested in possibly having home care. And that's quite a challenge for a lot of people with the first time they've had strangers in their home. So Janice is great with that. Janice comes from a background of home health, and she also had a business that she had of her own. It was a placement business to help individuals select places where they may want to live outside of their home if they needed to have that. So she's a great asset for us, where we welcome Janice to our team. Our other really great team player is Sue Joseph. She's our registered nurse. She's one of two of nurses that we have on staff. Sue's been with us for 3+ years.
3 years now.
And we're really excited. Sue's wealth of knowledge about nursing, of course, we're required to have nurses on staff, but it's just a wonderful thing to have her here to work with our clients and their families and our caregivers to help them navigate care and write the plans of care and really become involved in the relationships that we establish with our clients and their family members. So we're really excited. We hope we can try to help. Sue was a home health nurse traveling around Michigan,
Northern Michigan.
spending time out on the road working with families. And so she has a lot of experience in that area. And both of these gals come from the home health environment, help us understand how to navigate through some of the things that we all have to navigate through when our loved one is discharged and going back home from the hospital. It's a little bit complicated. So how many of you have been told at the 11th hour, hey, mom's got to go home tomorrow? Mom's got to go home in 6 hours, or you're just faced with a real challenge. It happened to me. My mother was going to be discharged to hospice care, and I found out at 8 o'clock in the morning they were going to discharge her at 11 in the morning. And we're like, oh no, what do I do? And this is before I even had the experience with Home Instead. So it was an eye-opening experience for me. But what we're going to do today is if you can kind of go to that next slide, we're going to go and talk about, ways to incorporate help at home for your family member, your loved one. And then we're going to, you go ahead and do the next one. The objectives we want to try to accomplish are understanding, this thing's a little bit behind for some reason, understanding when home care may be needed, and learn how to minimize your risk at the hospital, and reduce the opportunity to go back to the hospital. That's the last thing we want, right? Is not to go back. And the hospitals don't want you back either, because they kind of get dinged for that. So there's a lot going on with that. We want to give the family members tips to prepare for someone coming home. And when you have someone going to the hospital, you better go ahead and start that planning process the day they go in, because you don't really know how long they're going to be there, and you're going to, have to start to plan for what are you going to do when they come home, because their life may be drastically different than when they went in. And then we're going to help you with some other resources that are around to help you get to that. So let's look at a few things. Common reasons that home care may be needed to be considered to reduce a hospital readmission or any other type of care. You're discharged and you have a social worker and a discharge planner who's helping you kind of navigate what's going on. And so what are the reasons that you're going to have some help if you can't provide the help yourselves? They may have new limitations on their physical condition, or their cognitive levels may be changing. The ability to understand and follow discharge instructions, those sometimes are pretty complicated. And not well communicated sometimes. And if you've never experienced that, you're sitting there looking at this piece of paper going, oh no, what do I do with all this information? I just don't know what to do. Difficulty, they may be discharged with a lot of different medications that they never had before. And then they're already taking some medications, and how does all that work, and making sure that they get the proper care for that. Nutrition's a big thing, managing nutritional needs for people. And that's one thing that we see quite a bit in home care, is that proper nutrition really, really helps people maintain their health, hydration and things like that. You know, if somebody's gone in for a heart surgery or something, and, you know, they really had some horrible eating habits, and they need to change their eating habits when they come out. And boy, changing behaviors like that's tough when you're used to, you know, having certain ways that you eat. They could be a fall risk. You want to be careful that, you know, they don't fall and injure themselves maybe once again, but, you know, they're unstable. They're not stable getting up, and you want someone there with them that can make sure that they get up safely, get to the bathroom, get to the shower, or get out and about the house. And they may need transportation. They once were drivers and were able to take themselves to their doctor's appointments or to their hair appointments or nail appointments, if that's an important thing. And so you want some help with that. And then they may need some help with a bath, or, you know, getting to the bathroom, or just their, you know, their regular daily living activities. It's really important for that. And then maybe their family, maybe you, or as a family member, don't live close by and you need some help. You've got to go back home to your job or to your family, and you're out of town, so you might want to have some family support there. And then, you know, a lot of times being alone is really tough when you've come home from the hospital and you don't quite know what to do with yourself, and you feel insecure about your ability to get around. And so, and navigating our healthcare system is always tough. So it's really important that there are some reasons that having someone be in the home, whether it's a family caregiver or whether it's a paid caregiver, whatever it is, you understand what your roles need to be, because you're going to have to probably do all of these things and understand it and provide the assistance that somebody needs. And I'm going to skip that next slide. That's kind of something I think we didn't go over. So let's talk about a little bit about what readmission drivers are, what from a provider perspective. That means that's the hospital, right? And so discharge decisions are complicated sometimes. The pressure to discharge quickly is there. It's real and it's there. And either the pressure to discharge quickly from a family member may want somebody out of the hospital quickly, but the hospital certainly wants you out as quickly as they can get you out safely. So that's a really delicate balance there. The communication challenges are there because you need to understand who's going to do what. You may have physical therapy, you may have occupational therapy, you may have respiratory therapy, you have the nurse, you may have hospice care. You as the family member, what are you going to do? You're going to have other roles for other people in your family, and everybody needs to be really clear on who's going to do what, because that's where it gets all jumbled up. And and then nothing happens, and then all of a sudden you're in a little bit of a pickle. The one thing that is, patients are not always honest about how they truly feel. They want out too, and so they're going to say, "I feel great," I'm like, "No, you really don't." But they may really not be honest with exactly how they're feeling, and so you have to be aware of, make sure that mom or dad is really as healthy as they need to be when they need to leave. And then they may not have the means to meet their basic needs too. So there's a lot that goes on into that, in those decisions. That's from the provider. But what about the patient? When you said the patient, may not be honest, but they don't understand their discharge instructions. They don't understand, really what's going on, and they need help. The care instructions are general. The social worker discharge planners really trying to go over all this, and this is kind of, it's Greek to everybody. You've never heard some of these terms before, and while they use these terms every single day, everybody in our lives, we use certain languages in our businesses or whatever, and outside of that sphere, nobody really understands what those things are. The primary care physicians may not be in the loop, really, because the hospitals have their own physicians in there. And so you got to bring the primary care physician in to become aware and get educated on what's going on now. Nowadays, a lot of times with electronic, medical records, that's all pretty accessible, that your primary care physician can kind of get up to speed. And then There's limited support at home, so patients are a little bit afraid that they're not going to get what they need, and they're a little bit insecure. And then, like we said before, that some of them are not ready to change their behaviors to stay healthy, and that's really important. And then, just how to do your follow-up care and make sure you make it to your doctor's appointments and things. So all these things are really confusing. And as a group here, while I'm kind of going through this formal PowerPoint thing, I just want you to understand that if you have questions, raise your hand. These ladies here are truly experts in what they do and have seen so many different scenarios around that they can help you make decisions or understand different examples. So just because we're up here reading from this thing doesn't mean that please feel free to interrupt us and ask whatever you'd like to ask us. I was going to try to get to the next thing. Oh, I want to skip that slide there if we can. Okay, so let's get into who does what. So somebody comes home, and there's several steps you need to follow. You need to put the care team together. Who's going to be doing what? And there's the patient is in the middle of all this. Then you have home care, you have home health care, then you have your family and whatever other support they may need. And this slide shows you, and there's something, and we're going to let Sue talk about this a little bit, but home care and home health care are two different things. And a lot of people confuse that. And home health care is medically related. Home care is not necessarily medically related. And so home care can be an agency like ours or Griswold or whoever, or Comfort Care, and they're paid, but you also have family caregivers. So who is the home care person that's going to take care of the basic needs of somebody, getting them to the bathroom, getting them fed, getting them to their doctor's appointments? Home health care doesn't do that. And then, what role will the family play in a lot of those things? So it's really important that, we have a definition of who does what. I know in our business, when we talk with family members, and maybe there's 3 siblings, right? And they're all calling us, and we're like, okay, time out. Somebody needs to be the spokesperson for the family, because we'll get instructions from this daughter and this daughter and this son, and they're all different. And our job is to take care of that family member the best that we possibly can, and we have to have a central point of contact. And that's kind of the same way if you're coming home, that you manage that and take care of that family member, and making sure that you have someone who's the spokesperson for your group or your core group of people, because it can get very, very confusing, and you want to make sure that they get the very best thing that they need. I think that's one of the challenges that we see sometimes, and we get, you get in the middle of some of those relationships, and it gets a little confusing for us too on what's the right thing to do, because you want to take care of, they're hiring you to take care of them. But so anyway, for the family member can play a big role in understanding the plans and the goals and oversee all these other things that are going on. And so that's where you as a family member can come in and say, okay, I'm going to be the manager of these things, and then we're going to have everybody have certain roles and understand what they're going to be. Things that the family can do is understanding the plans, prepare the home. We're going to get into that in a little bit about safety in the home and making sure that things in the home are adaptable to someone coming home and may have some physical limitations. Communication with the healthcare team is important. Provide instructions to other family members so that they know what their roles are. Emergency contacts and medical contact lists are very, very important. And I know that we require that in our organization, that if we're taking care of someone, we need to know, even though the client may be the core decision maker, something could happen, and we got to reach out to somebody else. We need to know who those people are, and you all need to do the same thing. And who's the main contact? Who are the other people that need to be helpful? Who's going to pay the bills? Dad's been writing the checks, and Dad can't write the checks anymore. who's going to be writing the checks and paying the bills, access to the bank accounts and things like that. Things like that sneak up on you, and all of a sudden, you can't do that, and you got, the Duke Energy wants their money, that no matter who's doing that. So, and you don't want to have to come out of your pocket. So you need to think about that. Who's going to take care of their mail and make sure that, things get opened and taken care of that need to get taken care of. And the other thing too is, do you have the proper documents in place? Like I was saying about, who's going to write the checks, but do you have advance directives and living wills and things like that? And where are those documents for, your family members, so that are they housed in a place where the key people in the family know where they are and how to access them? That's very, very important. My father was so pragmatic, and he had everything just outlined on a piece of paper, and who we needed to call and who was in charge of what on his whatever finances and the bank and his lawyers. It was just so helpful when he was very, very sick and we knew we were going to lose him, that we had an opportunity to be with him and not worry about those other details. It's really important that families take over some of that role. So, I'm going to let Sue talk a little bit about the home health care piece, that she has the experience in that, and where home health care can play a big role in taking care of the family member, and what role they play, and how they can continue to keep this person on the path of getting recovered from being in the hospital.
This is not sliding.
Is it not going?
No.
It froze.
It
Oh,
froze.
it's there. It's there.
It's up on there,
Okay.
but it's stuck here. It's saying it's stuck. So.
Well, we can talk.
I can just rattle away. I was in skilled home health care in northern Michigan for about 13 years. It has changed a bit since then. The first thing you need to do as a family member, because I just went through it, is sit down with your discharge planner or your social worker, even the RN that's working the floor, and talk about what are we going to do when so-and-so is discharged. I am a real advocate for skilled home care, even if it's for 2-3 weeks. This is intermittent, short medical vantage point. I'm a real believer in having the RN come out and do her assessment. And of course, we need doctor's orders to do this. So I would talk with the discharge planner and say, can we get a doctor's order for skilled home care? But this part of the recovery to me is important, because you need your RN to go in and do general assessment. And I'm a real believer in teaching. We need to teach about the different medications, the diagnosis, how we're going to handle our life at home. Some people need physical therapists. Quite a few people need physical therapists, to be honest. And so that needs to be organized. Occupational therapy helps with those adequate daily living skills, getting back to taking a bath or a shower or working in the kitchen. Then the social worker is important. I had many times where family from southern Michigan would come up to northern Michigan, and the whole family would get together and talk about what are we going to do for mom or dad. So I feel they're important. They even have clergy in the skilled, not used too much, but they are available. So we've talked about PT, OT. Nurses' aides will go in and help with bathing. These people usually are in the home 30 minutes to maybe an hour, hour and 15 minutes. And the goal is to start a little bit heavy with your services, and then you start weaning back as they're improving. So it's a rehabilitation time. The patient, client, whatever you want to call them, they need to be homebound, and that means they're not out driving the streets. That if they have an appointment to the doctor's, somebody else is driving them to the doctor's office. That's a strong criteria with home health because Medicare, Medicaid, VA, your personal insurance is going to be billed for those services. So they've got certain criteria that should be followed. They will take care of your post-op rehab, your skilled assessments by the nurse, PT, OT. They've all got to go in and make an assessment, come up with a care plan, and figure out how they're going to reach that goal and the steps that they're going to take to reach that goal. So at the end, they can make a true assessment. Did it work or didn't it work? And do we have to regroup? A lot of the nurses will go in and do wound care. They also will, of course, the PT will work with mobility. The nurses also work, and PT works with pain management. And in today's era, they go in and work with IV fluids and those types of medications. Years ago when I was in it, they were just taking off with that. That was kind of a new facet, but now that's very much used in the home, or any IV medications and PICC lines and such. So,
You know, one thing too is we're seeing more and more of the health at home scenarios where you see, with COVID, you had a lot of the virtual doctor visits, right? But it's becoming more and more acceptable to have more care provided inside the home than going out to receive care. And that's going to continue to increase because the population right now, with this older population, we're aging quickly. There's a bunch of us aging quickly. 10,000 people a day are turning 65 right now, and it's going to continue to be that way for a while. So you have to have ways to accommodate that bigger population. If some things can be handled virtually or in the home, then it makes more sense, and it is financially better. So Medicare is going to continue to revise their guidelines too, and it's going to be wonderful to see some of those things come around.
I agree.
But there's a big distinction between home health care and home care. And so Janice plays our role here in meeting with prospective clients and listening to their stories and why they need help at home and why they need help coming home from the hospital. And so she's going to spend some time talking about that for a minute. I don't know if we can get that little slide change.
It will not.
It won't move at all.
It's
Okay.
just stuck.
Is it?
It
Okay,
is
it's on. Okay, there it is. Okay, thank
Okay,
you.
well, as long as it's over there. So, as Patty mentioned, home health and home care get confused to families. They're calling us when I speak to families. They're starting to talk about nursing, wound care. They start down that road, and I say, we're non-medical. We're more focusing on, helping you with caregiving, errands, companionship. If they need, just someone to be there to stand by, assist, to make sure they can transfer themselves, we help with that. So I go through that because a lot of people are confused that it's home health and not home care. So, we have home caregivers that go into the home and help with those items of the activities of daily living, help with meal prep, take them shopping for groceries if they need it, help with their refrigeration, with spoilage, food, to make sure that there's no food that's bad. And they're just eyes and ears for the family that they might not be in this area. So we're there as eyes and ears for that family and, give an update like, well, something's going on here. Y'all need to be aware of this. So we do a lot of specialized training to meet the needs of these older adults. We do a lot of training, more so than what really state requires. And do you have a question?
I do. Could you explain for us what activities of daily living are?
Mm-hmm.
We hear that all the time. That's really what you mentioned that. I wonder if you could explain that.
Sure. Activities of daily living like bathing, dressing, grooming, toileting, things like that.
Ambulation.
Transfer assistance, things
Thank
things
you.
like that. And socialization is very important when people are at home alone, especially if they live by themselves. We come in and we are their companion. And that's what we go in, we develop relationships with those family members and the caregivers, really try to get to know the family member and, become their friend and do games, puzzles, watch TV with them, watch movies, whatever they'd like to do. We're there to support them in any way we can. Payment for us that's where it gets confusing when people call in. They think home health means, that's going to be Medicare. And then I have to explain that, home care is different. If you have long-term care insurance, that's great because that would cover our services. But otherwise, it's private pay, or if you're a veteran, there's a benefit through the veterans that you can, get the payment covered through them. And also Medicaid provides that as well. Some home care companies accept Medicaid. So,
And I think that the biggest distinction is home health are real skilled people and, nurses and PT and OT folks. And so some of the families can be this home care role. And I think the point is that, understanding that, the home care role can be assumed by an agency type, private caregivers, or a family member, but to not expect, when you call a home care company, to expect to have home health covered. So there's a lot of confusion in that a lot of times when people call, and we have to talk to them about that. And I don't know that the folks at the hospitals really explain that to them. And so if you have a need that you're out there and your family member is alone, and you can't be there with them, you have some opportunities to talk to people where you could get some assistance. And it doesn't have to be all day long. You could have somebody come in for a little while to help them. But understanding the difference between those two things is really important. Well, we do get a lot of calls for that. I don't know. There's folks here they're from the skilled area, and I think Ashley was nodding her head that she says, they kind of get the same thing too. So it looked like you had a question.
So in the scenario where the client patient is clear-headed, but they have a child, are you working for the patient or the child?
The patient.
the patient, right.
So as far as giving feedback, is that does the patient determine, okay, at the end of every week, call my daughter, or how does that work?
Well, typically in a home care scenario, our patient, the client or patient contracts with the home care agency. If that person is not cognitively together, then the family member, somebody from a family member does that. But say in your scenario, if they are, they just physically need some help, say for instance, if it's you, then you contract with us and we communicate with you. And you manage your schedule, you decide what you want done. Our nurse writes a care plan and our staff follows that care plan, but the relationship is with you. Now you can have a family member as a contact that, would have us, support if you want them to know what's going on, absolutely. And everybody has it different ways. So, most people are pretty flexible with that. But if someone has a cognitive impairment, then we steer away from them making serious decisions.
Okay.
Yeah.
All right.
Yeah. Does that answer your question?
Yes, thanks.
You're welcome. You're welcome. But yeah, it's just, everybody's situation is different, and that's why it takes an evaluation to go in and take a look at it. And, those evaluations are not happening at the hospital. They don't have time for that. And so having a more in-depth evaluation even from a home health nurse that comes in, and they may assign that, the home health nurse can also say, hey, it's not a good idea for you to be by yourself for the next 2 weeks. Let's try to figure out a solution for that. Mm-hmm. A good home health nurse will do that, and say, you need to have some help. And that way, and then you can decide if you have a family member that can come and support you, or if you need to hire somebody. So,
Yeah, I think it's important to utilize the whole community. There's plenty of help out there, and sometimes it's confusing as to where to get the help. So that's part of the role too, is for mine to have a little bit of background on Guilford County and where you can go to seek an answer. So I try to be pretty proactive in my position. So I'm there to help the client and the family member, hers.
And me as well. Many times people ask, about Meals on Wheels. How do I get her signed up for that? Or what resources can we utilize in the community? So we need to be aware of all those so we can help the family.
Right.
And because a lot of families are out of town and they're not
Right.
boots on the ground here, so they're looking for us as their, referral source or a navigator, so to speak, to help them find what they need for mom or dad or their uncle or whoever they're trying to help.
Okay.
and any organization, even in the skilled care area or whoever pays, it's our job to be familiar with the resources that are here and around us, because not everybody is a fit for home care. But when somebody makes that call and mom's coming home in 2 days, oh Lord, what do I do? Tell me about her. Spend some time having a conversation with this person and find out what their needs are. We might not be able to help them on the home care side initially. They may need more advanced care. And, it's our job to make sure that we have the resources that we can help you and you figure out what to do. And we do spend time doing that. And we enjoy doing that because we feel like we're part of this whole care community anyway. And that's a hard call to make anyway.
Right.
And so it's important that we try to handle those calls and just say, I'm sorry, we can't help you, and hang up. You wouldn't want to do that. So Cheryl, I have a question.
Do you need formal permission from the patient in order to talk to their family members? What does that look like?
Well, they actually list their contacts out for us on our forms and give us permission to talk to them. And in our system, we have it out there that is their main, they are our primary contact or their secondary contact. And sometimes the family member has the power of attorney. We get that information too, so.
And I get a lot of calls that come through that are the family member saying, Mom is coming home. We don't know what to do. She refuses to go to rehab. We want to keep her at home. Tell me a little bit about what you guys do. So, we'll go through what we do and how we can help them.
I also work on equipment that might need to be added. Discharge planners figure out the best they can what's going to be needed in the home. But once I get there, I can start making an assessment as to, do we need additional things or different things? And another big thing I'm on is medication. I just really feel that we need to have that laid out to make sure we've got someone at home, if the client cannot do it, to fill the pill containers. And we've got drugstores right here in Greensboro that will set up your medications in little bubbles. And so, to me, that's important, along with why are we using the medication and what are some of the simple side effects that I might want to look for.
Because usually when they're discharged, they've got a couple of new medications, and there might be some side effects that that they weren't not aware that was going to happen. So that's very important. So you're right, medication, especially discharging with new medication.
And a role of the caregiver is to make sure that they take those medications when they're supposed to. As we know, if you don't do that, then you could end up back in the hospital again. And that's one way we want to avoid going back, is managing those medications and understanding that. But those little blister packs are kind of cool. And you get them and it's easy to just hand it to the individual and say, you need to take these at 2:00 today. and make sure they take them. Someone with a cognitive problem just said, "Did you take your pills today?" "Oh yeah, I took them." Well, they didn't, so you have to just make sure they take them and watch them take them. As a family member, they could do the same thing to you, and you just make sure you see them do it because they'll tell you they took them and they didn't do it. They'll tell you, "Well, I had a bath today and they had a bath 3 days ago." You just really need to make sure that you're managing those things properly and staying on top of it.
I had a client in the home health arena when I worked for a home health company that told everybody, "Yeah, I took my medicine." Well, she didn't. She had it stored in a drawer. And, it was significant medication she had to take. And then she would fall and they couldn't figure out, well, she's taking her medication, what is going on. And then they found it in the drawer that she had refused to be, taking her medication. So that is very important.
Yeah. So somebody playing the role to keeping eyes and ears on that, and people can get a little sneaky and tricky.
Yes, they can.
To fool you, and you have to stay on top of that. That's pretty important to do that. But there are so many ways to manage that today that, technology is so helpful with that. The one thing too is that, make sure that old meds are disposed of in the home. The last thing you want is somebody to get hold of something that they shouldn't be taking or it's expired, and making sure, someone in the home is getting rid of medications that don't need to be there. And, there are a lot of events and stuff that have, get rid of those medication days and things like that go on in the community that you can dispose of them properly. Another thing too is, that we went through one of the roles of home care is to making sure that they make their doctor's appointments and follow up on their doctor's appointments. Because after coming home from the hospital, staying on track with following up and making sure that they're doing everything and they're progressing like they're supposed to progress is really important. And hopefully there's a family member there that can take them and make sure that they can get those things done. If not, home health won't take them to their doctor's appointments, but home care will take them to their doctor's appointments. So that's a big delineation there. Sometimes, it used to be, we don't have it anymore really as much as doctors, coming to your home. That doesn't happen. We used to think that was going to be a great thing, but they just don't. They just got too many people to see, and traveling around town is not something they're going to do. They don't have time, and they have so many patients, and it's just so hard for them. And when you go into a doctor's appointment now, sometimes it's pretty quick that they see you, but they've got that. Not that they don't care; they have a lot of people they have to take care of, and they want to be as efficient as they can. So.
And our home care professionals can, take notes for the family if they can't be there, and, report back to the family about what was, going on at the doctor's appointment. If they're out of town,
Right.
if the family is.
And are we running on time, shall we? The nutrition and hydration. Okay. Nutrition and hydration support's really important. So kind of breaking these things down, meal preparation, if people are coming home with restricted diets, understanding what those are and how someone can prepare those for them or have them pre-prepared. There are a lot of meal services now that you can contract with to have nutritionally balanced meals for a particular condition. That's important. The other thing too is if someone knows how to cook in your family and cook a nice meal for somebody, if they have to limit, they're coming home on, you can't have any more big juicy hamburgers for a while. You've got to have something else. Eat more chicken, but you've got to do that and make sure you get what you need. Hydration is really important.
Real important.
Very important. We see people that do not get enough water or hydration, and that will throw somebody in the hospital with skinny minute, and they get there and then they have UTIs or they, all kinds of
Dehydration.
all sort of things happen, and that will make that happens quickly. But when you're older and you just don't want to get up and get yourself anything, right? But you've got to make sure that you drink plenty of water.
And that's where our caregivers come in, to just keep the hydration moving along.
That's right, that's right. And then other things too that the family member needs to understand is, arrange for housekeeping. They might not, your loved one might not be able to run the vacuum cleaner for a while. They might not need to be able to do their laundry and change the sheets on their beds and things like that. So if a family member needs to come and do it, or if you have a private caregiver or you hire someone to come in and do that, those kinds of things need to be well defined. So keeping up with things like that, manage their schedules and making sure they're going to their appointments and things like that is really important. We've covered a lot of ground. It is a very important thing for people to pay attention to. And we run into these, like Janice and Sue, these phone calls that we get, people coming home and don't know what to do, and they're surprised by some of the instructions that they receive. We've leaving you with, and I've put in the slides the website addresses for these two, for the people who are watching virtually, but there's a home safety checklist here that we have prepared that you could have and read through. If somebody's coming home, there's some things to take a look at for you to decide, what do I need to make sure my home looks like, or their home looks like when they're coming home from the hospital, so that they can come home and arrive safely. That's pretty important. Rugs, they could trip over a rug if they're on a walker, or, loose rugs are just a no-no when someone's coming home if they're having mobility issues. Getting into the bathrooms, many of the older homes have very, very small bathrooms. And you need to try to, handles, safety bar handles in the bathtubs are very important. You might need a raised potty seat because it's hard to sit down on the lower potties that are in the older homes, and do something like that they can get up and down on. And that's when Sue gets involved with the equipment like that.
Medicare will pay for a commode, and the neat thing about those is they can sit over the toilet, and you've got your two handles just when you're sitting down to hold on to, which helps with your balance. And that product, I think, is a great invention, because if you don't use it over the toilet, then it's got all the makings to use it at the bedside or wherever. So it was a good invention as far as I'm concerned.
But really paying attention in this safety checklist, and there's a booklet here called Returning Home that you can download as well, but I have these printed here. And that's just really a summary of everything that you've seen today on the PowerPoint, but it has a little bit more detail to it. And you're welcome to take these home with you. And folks who are listening virtually, you can download these as well. The websites are out there. So I really appreciate your time. I know this is, you don't want to have to deal with something like this, but if you do and you have questions, you're welcome to call us, and we'll be happy to try to answer your questions at any time. And we appreciate your time. Any other questions from the crowd? Yeah. No. All right. Well, thank you very much.
I just can't thank you enough for your wonderful presentation. It was clear, it was detailed, and at the same time, it for me would have relieved so much of the stress and anxiety that I felt when I brought home a loved one from the hospital with not nearly the understanding I would have now. I would invite you all, this is a good time to tell you that this presentation has been recorded. There was so much information. Go back and look at the recording and pick up the information that maybe you passed by the first time. Thank you so much to Patty Aiken, Janice Burns, and Sue Joseph of Home Instead. I appreciate your being here.
Thank you.
I'd also like to, again, give special thanks to PACE of the Triad for sponsoring our program today and for being a wonderful partner for ACAP Guilford. We meet every month, and next time we meet will be September 19th at 11:30 for lunch, and you're going to RSVP so that we have lunch for you. And then we will have a presentation that's titled Understanding and Treating Vision Changes as We Age. That sounds, really? But actually, there's so much to know about the kinds of changes we can experience, how to treat them, and importantly, why it's important. It's not just seeing, it's staying socially active, it's keeping your brains working well, and so forth. So we'll have a very interesting conversation with Jason Gould, again on September 19th. Register for lunch, see the recordings on our YouTube channel. And we'd like to thank you very much for being with us today. We look forward to seeing you in a month. Bye-bye.
Very good.